I'm Professor Shaheen Mehtar from Stellenbosch University, but also from the Infection Control Africa Network. And I'm an Ministry Advisory Committee of South Africa, and as well as working with the WHO as a consultant. So my interest is particularly to stop transmission of SARS-CoV-2, which causes COVID-19, in the community. And we have been very involved instrumentally trying to get the best possible mask at the cheapest possible price to prevent transmission from one person to the other. This has to be obviously done with social distancing and hand hygiene as well. Good hand hygiene as frequently as possible. So the concept of the mask is that the cloth mask is not a medical mask. It's really important to remember that. And that's why it will stop droplets from me going to you, and you wearing a mask, your droplets will stop coming to me. So basically the concept is in the community that I protect you and you protect me. And this is very different to a medical mask or a surgical mask, where you're trying to prevent yourself from getting contaminated from the outside, or with the respirator where the contamination comes towards you. This is from you outward. And that is why it's so essential that when you're in closed communities and in closed spaces like taxis or malls or whatever, you really need to protect yourself and protect others while you do it. So the mask that we're talking about here is the Ubuntu mask that has been approved by the Western Cape government. And this has got 2 layers of cotton on the outside and a polypropylene spun bound on the inside. The estimated trapping of this is about 70%. If we just have layers and layers of cotton, each layer of cotton is supposed to give up to 10% filtration rate. So it is actually, therefore, a very protective way of doing it. And this one is useful because it can be washed. You don't have to touch it. You take it home. It's got elastic. It's got a tie. And you can use it the way you want to. And it is reusable over a period of time. So I think it's really important that everybody gets one of these, at least 2 of them. So one of them is used. The other one is washed and cleaned and ready to go. So basically, if you're going to be wearing a mask, this is first thing in the morning at home or wherever you are, what you do is you first actually decontaminate your hands. I use alcohol-based hand rub, and you should have a good clean mask available to you. This is the mask that I use. This one has got elastic in it, but you can have it with tape, which I prefer personally. So the reason this mask is good is because it fits rather well. So for this purpose, I've just kept them together, and I put them on, put them behind me. I make sure that the top one sits on top of my ear, so it holds it, and the bottom one is at the bottom, around my neck, and then we just flatten it against. Okay. You can walk around with this when you're out. It's really comfortable, so you don't touch it, you don't keep adjusting it, you don't move it around, and you're perfectly happy to walk around with it. So when you come home, the first thing you do is you take off your mask, but you don't touch the front of it. You take it from here, from the back, and you take it off like that. So you haven't touched it at all. Your breathing and your droplets or your bacteria, whatever you want to call them, on the inside, that is the bit that you really don't want to touch because that belongs to somebody else. And when I'm at home, I just drop it in the sink or in a tub or whatever I'm going to wash it with, and then that's it. And then I do my hands again.